Peripheral edema, causes and workup. Peripheral edema is a common clinical manifestation involving fluid accumulation in the tissues, often due to impaired venous or lymphatic return, and is a key indicator of underlying pathology. Overview. Peripheral edema refers to the swelling of the extremities, particularly the legs and feet, due to fluid retention. It is a common symptom in various clinical conditions and can be a sign of serious underlying pathology. The edema is typically localized to the periphery and may be accompanied by other signs of fluid overload or organ dysfunction. Pathophysiology/mechanism of action. Peripheral edema occurs when there is an imbalance between fluid production and drainage. The primary mechanisms include impaired venous return, lymphatic dysfunction, and increased capillary hydrostatic pressure. In the case of venous insufficiency, the valves in the veins fail to prevent backflow, leading to fluid accumulation in the lower extremities. Lymphatic dysfunction, such as in lymphedema, results in impaired lymphatic drainage and fluid retention. Additionally, conditions that increase capillary hydrostatic pressure, such as heart failure or nephrotic syndrome, can contribute to edema. Clinical features/indications. Peripheral edema is often associated with symptoms such as pain, pitting, and reduced mobility. It may be acute or chronic, and can be classified based on etiology. Common indications include heart failure, renal disease, liver disease, and venous insufficiency. Patients may present with a history of weight gain, fluid retention, or swelling in the lower extremities. In some cases, edema may be associated with other systemic conditions, such as diabetes or autoimmune disorders. Diagnosis/monitoring. Diagnosis of peripheral edema involves a thorough history and physical examination, along with laboratory tests and imaging studies. Initial assessment includes evaluating for underlying causes such as heart failure, renal disease, or lymphatic dysfunction. Laboratory tests may include serum electrolytes, creatinine, B-type natriuretic peptide, BNP, and urinal analysis. Imaging studies such as Doppler ultrasound or magnetic resonance imaging, MRI, may be used to assess venous or lymphatic dysfunction. Monitoring is essential to track the progression of the condition and to evaluate the effectiveness of treatment. Treatment/management. Treatment of peripheral edema depends on the underlying cause. For venous insufficiency, compression therapy and lifestyle modifications are often recommended. In cases of heart failure, diuretics are used to reduce fluid retention. For lymphatic dysfunction, manual lymphatic drainage and compression garments may be beneficial. In severe cases, surgical intervention may be required. Management also involves addressing the underlying condition, such as controlling blood pressure in hypertension or managing diabetes to prevent complications. Key clinical points. Key clinical points include the importance of differentiating between acute and chronic edema, the role of fluid balance in diagnosis, and the need for a comprehensive approach to management. Early recognition and appropriate treatment can significantly improve outcomes and prevent complications. Patients with peripheral edema should be monitored for signs of worsening conditions, such as increased swelling or systemic symptoms, and should be referred for specialist evaluation when necessary. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.